Bismillahirrahmanirrahim. Assalamualaikum and good evening, everyone. Thank you so much for inviting me to share about dementia. So without further ado, I'm just going to go on to my slides and refer to my slides as I give the talk. Okay. So, okay. Yeah. Many people have dementia. Look at the statistics. In 2018, there's 50 million people with dementia, projected to have 82 million by 2030 and 152 million by 2050. And so I'm going to speak in Malay. So ramai manusia mempunyai demensia, 50 juta dalam dunia pada tahun 2018, dan nombor ini akan meningkat 152 juta tahun 2025. In Singapore, in 2015, 1 in 10 people aged 60 has got it. 82,000 in 2018, more than 100,000 in a few years' time, means right now. Yeah. So di Singapura pun sangat ramai yang mempunyai dementia. 1 dalam 10 orang umur 60 mempunyai dementia. There are 3 common misperceptions of dementia. So the first one, dementia is about being forgetful. No, it's not just about being forgetful, it's more than that. Second misperception, dementia is part and parcel of old age. So only old people get dementia. If you're old, you will get dementia. That is not necessary. That's not true. Although the older we are, the more risk to get dementia. And then the third misperception is that nothing can be done to help the condition. Again, there's plenty that we can do. Ada 3 salah tanggapan tentang penyakit dementia. Dementia bermakna lupa-lupa. Ia lebih daripada lupa-lupa. Dementia itu kerana tua, tak semestinya. Dan tak ada apa yang kita boleh buat untuk orang yang mempunyai sakit dementia. Itu tidak benar. So there's a drawing a depiction of the human brain. The human brain is very complex. So you have different lobes: the frontal lobe, parietal means that it's at the side, temporal at the side, and then the occipital lobe. So different parts of the brain contribute to different things. So frontal mainly our intelligence, judgment, and behavior. Temporal mainly memory, and then the parietal, which is I can't remember. Sorry, I'm not a neurologist. Okay, so keep going. All right. So the word dementia describes a set of symptoms that include not just memory loss, but also difficulties in thinking, problem solving, or language. Perkataan dementia itu bukan hanya melibatkan hilang memori, tetapi juga kesukaran dalam pemikiran, penyelesaian masalah, dan kesukaran dalam bahasa ataupun pertuturan.
Sorry, Dr. Radiah.
Yes.
Dr. Radiah, there seems to be some interference with the noise.
Oh, sorry.
The sound. Is it a fan? You do have a fan?
Yeah, I've switched on the fan.
Yeah, that's right. So the fan is interfering with the sound. Another thing, you can just carry on with English. I will translate for you the.
Oh, okay. All right then.
Yes, carry on, please. Thank you.
Sorry, thanks. Okay, so the changes small to start with, but for someone dementia, they can become severe enough to affect daily life, to affect the functioning, and then and a person with dementia can also experience changes in their mood or behavior, because especially if it affects their frontal lobe. So when we talk about signs of dementia, at least 10 signs. So you have, for example, misplacing things, that's under forgetfulness. Forgetfulness that affects day-to-day function. Then difficulty planning or solving problems. Withdrawal from work or social activities, withdrawal from people. Poor or decreased judgment, difficulty doing familiar tasks, for example, cooking, cleaning, shopping. Problems communicating, especially if it affects the language area. Changes in mood or behavior, changes in personality, confusion of time and place. That's partly because of memory loss. And when we talk about dementia, it's not just one type of dementia. There are different types. But the most common is actually Alzheimer's. Actually, that's better. Okay, when we talk about Alzheimer's disease, is the most common type of dementia. And this is due to some abnormal proteins that cause the brain cells to die. And Alzheimer's disease, the symptoms are often to do with loss of memory. So if you look at the picture there, healthy brain and severe Alzheimer's disease, very different. No? There's what we call atrophy or the shrinking of the brain cells. And then the second type of dementia, the second common one is what is called vascular dementia. Vascular comes from the word vessel or blood vessel. So, and this happens when the blood supply to the brain is interrupted. For example, if you have a stroke. And when we talk about strokes, there's basically two types. Hemorrhagic stroke, that means when a blood vessel bursts. For example, if someone's got high blood pressure, not well controlled, and the blood vessel in the brain actually bursts, or there's an abnormal blood vessel that bursts, you can get a stroke. And then the second type of stroke is called ischemic stroke due to blood clots that block the flow of blood to an area in the brain. So I think hemorrhagic stroke is worse than ischemic stroke. A common thing that happened, quite common to people with diabetes who don't control the diabetes well, they can get small ischemic strokes, small ones, and that can contribute to vascular dementia. And so they get problems with thinking and planning and memory. Actually, it depends on which part of the brain is affected. And then there's another type of dementia with Lewy bodies. These tend to happen in younger people. The name comes from tiny structures inside the nerve cells or the brain cell. And this dementia, there's less to do with forgetfulness or memory loss, but the symptoms more to do with fluctuating or changing alertness. That means they can get drowsy or hyper alert. And then they can have hallucinations where they hear voices or they can see things that are not there, visual hallucinations. And also problems with movement disorders. There's still another type called the frontotemporal dementia. This one not so common at all, but it happens when there's damage that happens in the frontal and the sides of the brain. So, frontal dementia. So what is affected is the personality of the person. Our frontal lobe governs, affects a lot our personality and our behavior and language as well. Sorry, the parietal lobe controls the language area of the brain. So, and then when we talk about dementia, we talk about stages. What I'm showing here applies mainly to Alzheimer's disease dementia because Alzheimer's is the most common. So early stage, the person may be forgetful, losing track of time and becoming lost in familiar places. Not too bad, can still function, but unpleasant to them and the loved ones. And then you have the middle stage dementia where the dementia gets worse. The person becomes forgetful of even very recent events and people's names. Sometimes they forget whether they've had a meal, whether they've had breakfast, for example. So it's not a good idea to ask someone with dementia whether they've eaten. Instead, you can ask, are you hungry? They can feel if they're hungry, but if you ask whether they've eaten, they may not remember. Becoming lost in their own home, great difficulty with communication, needing help with personal care, like, activities of daily living, like having a shower, putting on clothes, and experiencing behavior changes, including wandering and repeated questioning, asking the same question again and again because they cannot remember. Now, the third stage is the late stage, where the person is unaware of time and place. They don't know whether it's morning or night unless they look out the window. They have difficulty recognizing relatives, so they may not even recognize their own children, for example. And this can be quite devastating to their family members. Having increasing need for assisted self-care, assistance in all activities, difficulty walking, and sometimes they can also be aggressive and due to behavior changes. This could be because they're hearing things and that is making them distressed. So depending on the stage of dementia, so when a person reaches a stage 3, sometimes the family member really cannot cope, and sometimes the family will send their loved one to a nursing home for continued care. So how do we reduce our risk of getting dementia? Or even if we do have dementia, what should we continue to do so that the dementia remains mild or doesn't progress too fast to middle or late stage? What are the 5 things that one can do to lower our risk of dementia? Number 1, it affects the brain, dementia. So let's try to stay mentally active as much as possible. Reading is good, writing is good, and then other games that involve a lot of brain activity, like playing cards, crossword puzzles, board games, computer games. Learning a new language or musical instrument is a wonderful way of staying mentally active. One might argue, alamak, so old already lah, how to learn new language? Nothing is impossible if you really put your mind into it. Then the other thing that is helpful and reduces one's risk of getting dementia is to be socially engaged. Meet up with people for meals and activities. Volunteer work is wonderful because volunteer work not only makes a person happy, but is a very, it keeps a person occupied. You make friends. So join a club like Club Heal or the Chapal initiative. Participate in community events. Then the other thing is healthy eating. So more fruits and vegetables, less sugar and salt. I think people know this. Choose food that is low in fat and saturated food. Why? Because this will reduce our risk of getting hypertension or high blood pressure, diabetes, high cholesterol. So very, very important to eat healthy food. And if you eat all the keropok and all those oily and food, it's not good for the emotions. You may be happy eating it, after that you feel bloated and you tell yourself, why did I just do that? Okay, keeping physically active. Exercise increases blood circulation and improve brain function. But the thing about exercise is not just about circulation. Exercise actually brings out all those feel-good hormones in the bodies. So it makes a person feel good, happy. And for people who smoke, who want to keep smoking, a good tip is to start exercising. That will help you to stop smoking. Start taking steps to an active life now. So exercise can be in a form of creative art like dance. That's a form of exercise too, and it's fun, accompanying music too. So, and last but not least, keep your health in check. So really, quit smoking for those who smoke. Go for regular health screening. Some people never go see the doctor. They thought, see the doctor, come out with money. I don't want to know if I have this and that. But if you don't go for health screening, we don't know sometimes that if you have high blood pressure or diabetes and so forth, because a lot of things stay hidden, until they become very bad. So health screening for anyone age 40 and above is very important. But even from a young age of 18, you should at least check your blood pressure. Monitor chronic conditions. So if you do have diabetes and high blood pressure and so on, make sure it's under control. Remember, vascular dementia is due to stroke, which happens if you have those other conditions that are not well controlled. The other thing to note is to avoid head injuries, and contact sports are not a good idea to pursue. For example, boxing, wrestling. Some people actually, hit the soccer ball with their head. That's a bad thing to do because you can injure the brain, even though it's housed in a skull. As much as possible, we don't want any head injuries because that will increase our risk of getting dementia. Um, Yeah, so stigma is due to ignorance. Tak kenal maka tak cinta. So it's important that all of us understand dementia and understand that if you see someone with dementia behaving in a less than pleasant manner or a strange manner, it's not just about the behavior. Think about the disturbance in the brain that has happened due to dementia that resulted in such a behavior. So it is important to find out more. Dementia is a common condition, and as far as possible, we don't want to get dementia. But even if we do, we need to know what it is that we need to do to remain positive. The video earlier that we saw, Anjang, he's such a positive person, very wonderful to see that even though he has dementia, he's positive and he has a wonderful support of his family. And so how do we communicate someone with dementia? Show care. Care. And what is care? Care is when you speak to someone with dementia, use clear, simple language and be patient. Don't talk like the typical Singaporean. Da, 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 da. It's too fast. It's hard to catch. So clear, simple, and patient when talking to him or her. Acknowledge his or her concerns. Someone with dementia may be worried, because they can't really remember. Sometimes they don't know where they are. They don't know who you are sometimes. So acknowledge his concerns, his worries. The person may be having hallucinations, may be seeing things that you don't see. So acknowledge his concerns. Remember to always show respect to the person with dementia. Don't say, nyanyo, nyanyo, apa ni nyanyo. No. Respect, because in fact, it's true, a lot of people with dementia are older people. So, but even younger people, we need to show respect and be reassuring. Be reassuring, remove their worries. And last but not least, E is for engagement. Engage that person so that you can provide comfort and build trust with him. Because someone with dementia can be very fearful of you, even people they know, because they cannot really remember sometimes. They've forgotten, and and that can result in difficult behavior. So engage them to provide the comfort and build the trust. So that's clear, acknowledge, respect, and engage. I think that's all I have to share. Not that much to share, because I thought I'd keep it short and simple.
Okay.
So that we invite questions and then can have, yeah.
Thank you so much, Dr. Radiah. That was really insightful,
Okay.
and I appreciate you taking the time to be here with us. But before we go into the question and answer segment, I would like to share I'm excited actually to share the next poem. And all this is in light to commemorate World Alzheimer's Day, and for me to hopefully use the art as a vehicle for us to spread this love for this community, okay? I would like to now introduce the next work. It's called Sesuci Ingatan. Another, in translation, it means as pure as memories. This work is, poem is written by Johanna Abdullah, artistic direction, music composition, vocal and poem recitation is by me. And this work is co-created and performed by Sabrina Nid Yusni, Akim Alianto, Kirsi Jasmine, Sharul Muhammad, Afika Rafi'i, Sufri Jawahir, and myself. Behind the scene, we have video direction by Nur Aslinda Miand, videographer and editor Ray Zuko, as well as backstage crew Kevin Tristan. Without further ado, let us have a look on the next work, Sesuci Ingatan. Sorry, let's do this again. Before you begin, this is a perspective from a son to his mother.
Berderai air mataku memandangmu, ku keliru. Mama, ku seru namamu, namun kamu membisu. Ku pasrah mengenang nasibmu, Mama, kehilangan ingatan yang tertumpu. Ingatkah Mama ketika menghantarku ke tadika? Bersama kita berkela, bercanda sesama keluarga. Ingatkah Mama ketika aku membelai rambutmu, menyelimutmu dalam kedinginan di keheningan malam? Hati kami bernyanyi, berdansa dengan irama syahdu, bersujud berjemaah, namun kehidupan satu perhijraan. Bolehkah gerakkan kami kembali senadi sejiwa? Kami senasib walau berbeza. Bolehkan kami mengimbas kenangan masa silam, tak lapuk dek penderitaan? Bolehkah kami membina harapan, cahaya untuk masa depan? Ingatlah Mama, kasih sedalam lautan, selembut sutera, sesuci ingatan. Mama, ingatlah, hidup hanya persinggahan, tak akan akhir sebuah impian. Ayo Mama, bersama kami ukir kuntuman-kuntuman senyuman.
Thank you for watching that. All right, so we have now come to the segment for question and answer. If let's say you would like to say to vocal to ask question, you can raise up your hand or wave. I try and find and locate you, and I will spotlight you. But if let's say you're not comfortable in speaking, you can write your questions in the chat function at the bottom, and we'll try to attend to it as best as possible. We hope that we have, in a way, inspired you or reach out to some of you who are wondering what is dementia about. And through this platform, we hope you have a better understanding, a better insight. And maybe, if you have any questions, please, you can ask Dr. Radiah. She's here to answer some of your questions, to clarify things. And if let's say you're interested to know more about the dance that I created for this piece, I would like to have Johanna to share her side on how she wrote this poem and how she had to get an insight about people with dementia as well. So anyone, just give me a wave. Oh, let's say I see many of you never on your video, so I wouldn't get to see you waving. So I mean, it'd be nice if you could turn on your video so I can see who is here present with us. Oh, hello everyone. It's nice to feel, the presence of people.
Okay, just a while here. I'll just read from the chat. Evelyn Foster says that she thinks it is good to make eye contact when talking to those with dementia because they have problems to understand when one talks from the side and they can't see a mouth. Very good point.
Thank you.
And Azaha also says, taking care of our loved ones with dementia require lots of patience. That's true because my father suffered from dementia in the last years of his life. So it requires a lot of patience. Carry on, Brother Shagan.
Okay. I'm just looking through for people who raise their hands. Anyone else on the floor would like to ask any question to Dr. Radiah or myself? Thank you for the compliment about the performance and the poem. Maybe I would like to take this time to ask Ms. Joanna to share with us what was the inspiration in writing the poem for the people with dementia.
Yes, we have a question from Nora. Brother Shagan?
From who?
Nora. Yes.
Hi, it's not really a question. It's more of like if you have a suggestion on how to help my grandmother because she doesn't have dementia. At least we haven't checked that part yet. But she likes to boil water on the stove. She likes to turn on fire, and even though we bought her an electric kettle, she still uses the stove to boil water. And then because it's a live fire, we are just scared that she forgets. So what, other than actively telling her not to do that, like live fire instead of using the kettle, how do we sort of suggest or in a way encourage her to use the electric kettle instead? Yeah, she has once or twice forgotten to off the kettle a few times, so that is very dangerous. So just if you have any suggestions.
Maybe I can answer. What is important is, if possible, persuade her to go see a doctor. If possible, get a referral from the polyclinic to see a geriatrician. That means a specialist in older people, and then they can, check her out. Maybe she does. Sounds like she may have dementia. So it's good to get the diagnosis first, and then it's not just about getting diagnosed. Then once you know what the problem is, and then you know what the challenge is, then you can bring in the relevant experts, for example, the case manager or the psychologist. At Club Hill, we have people approaching us for people suspected of having early dementia, but we really encourage them to get the diagnosis. But even if they don't, we have trained staff who understands and dementia very well and can help educate the family members how to communicate better with their first loved one. So, remember one of it is respectful and reassure. So whatever it is, when you communicate, you must show respect and be reassuring to that person, to your grandma. So I encourage you, if let's say your grandmother not keen to see the doctor yet, you may want to contact organizations such as Club Heal or Alzheimer's Disease Association, where we can visit, do a home visit, check out your grandma, and then together with you, work out a plan how to uh, meet the challenge that you're having now. Is that helpful?
Yes, she said yes.
Uh,
Is that helpful
yeah.
to you?
If
Dr.
you want
Yes,
to,
sorry, yes.
yeah, you can ring up
Yeah.
Club Hill 68993463, or you can email info@clubhill.org.sg, and then our care worker can work it out with you. In my talk today, I didn't elaborate on the role of the caregiver. I just one slide only, because I feel how we communicate how to with someone with dementia, that requires a whole session by itself. So that could be future talks lah. Today is just an introduction.
So Dr. Radiah, there's actually another question to talk about communication as you're mentioning. So there's this person, I'm not sure what's the name, saying that he's trying to find ways to communicate with his father who has Alzheimer's. And he said that he will climb up and he believed that his father is hiding his thoughts, or whether he's going through it. It could be very difficult for him to communicate with his father. So
Okay, to that I want to say that the thing about people with dementia, they may also at the same time have depression, and that's why they become uncommunicative. So we need to know, is it just the dementia, or is it he's got depression as well, or is it just his dementia, he has difficulty finding the words. Remember, someone with dementia, they have difficulty with language because it may affect that part of the brain that controls language. So it's when you say something to him, it's very hard for him to reply. It may be that because he cannot find the words to explain. So yeah, that's why it's not so easy. It's good to get the help of someone who specializes in this, or you can also meet up with other caregivers. They may face similar challenges in communication. So is it his dementia that's causing him difficulty to talk, susah nak, or is it maybe he's depressed? Sometimes they know they have something, and they get very frustrated.
yeah, I'm going to call upon Mr. Anjang to share his thoughts because he wanted to say something earlier.
Yeah, Assalamualaikum. I'm sorry, Dr. Radiah, just to
No,
share
it's
something.
okay. Yeah.
For Nura is very, very important for the caregivers. I mean, for us who have dementia, it's very important. The first thing is safety at home. So, like right now, Lian Foundation, they have produced a book about on how are you going to arrange your furniture and everything at home. But for your case, okay, for a dementia person, it's very important the routine. Routine is very important. So the routine, then there must be intervention. Intervention means that, if you see something that's not safe, you must, as what Dr. Radiah say, the care, slowly goes to your grandmother, put sit her down, hold her hand, talk, eyes to eyes. Just tell her, not to use. Whenever she use again, just redirect her to whatever that you are buying, So it must have a routine, a familiar routine. So for us, dementia person, okay, the first thing that is very important at home is safety. Secondly, the routine, the intervention of the caregiver. The caregiver must intervene, whatever that you see, but not by scolding them, you know, no, because as what Dr. Radiah say, they don't have really the mental, you know, they have a deficit inside their head. So you can always teach them new, you know, new routines. New routines. They, when you see, very important. Once if the person with dementia, they they really you know, trust a caregiver. You know, I can tell you, you can do anything to him. You can ask him to sit down. You can ask him to, you know, go to sleep or whatever. So you have to build up, you know, one caregiver or two caregivers, everyone must really build up relationship. That's all. Thank you. Sorry, Dr. Radiah.
Anjang. Okay.
Yes, there's a comment that, you know, it's very difficult when you don't get the support of the other family members.
Yes.
Yeah, actually there's a Malay saying lah, apa, berat sama dipikul, ringan sama dijinjing. But you know, when you feel you're the only caregiver and the other family members are not supportive, then it's very difficult. So I suppose in a sense you need to try to engage the other family members, involve the other family members. If everyone does a little bit, then maybe it's not so.
Yeah, I have one more question here. They say, how do we answer to a person with dementia when their parents actually has passed away a long time ago? Do we go along with them, or do we tell them repeatedly that they have passed away? This is by Jimmy Yusof.
Yeah, for me, the important thing is to be kind. You know, if you keep saying the person has passed away, you know, that is in a way, I think it's a bit cruel because as far as they are concerned, that person, maybe you go. I'm more to the going along with them rather than, you know, or change the topic. You know. So you're saying that the parents say, or talking about the parents who have passed on. I mean, you can talk about old times, but we don't have to keep saying that the person, you know, that they have gone. So, yeah.
Thank you so much. We have one question from.
Kindness is the key, lah.
Kindness. Hi. Hello, Kak Rohani. Do you have any question?
Oh, okay. Assalamualaikum. Saya cuma nak tanya, adakah ia satu penyakit depresi bila people with dementia bertanya soalan yang sama, macam seperti suami saya, dia kena vascular dementia dan dia dah tak bekerja lah. Tapi tiap-tiap hari dia tanya, hari ni kerja tak? Kenapa tak pergi kerja? So saya beritahulah, explain. So dah lepas explain, dalam 1-2 minit dia tanya soalan yang sama. Dan perkara ini dah berlalu dah setahun lebih. Tanpa henti-henti pada pagi sampai malam. Jadi adakah ini satu depression? Itu soalan saya. Terima kasih.
Saya rasa from his point of view lah, because dia punya short term memory macam lost lah, really lost. Yang dia ingat benda lama, benda baru, new things dia tak ingat. Jadi bagi dia ingat yang lama yang you are working, you know. So maybe you can say lah, you're working but you're not working at home. You know, you can say work from home. Boleh lah, as long as he's happy lah. Because if you say not working, pun susah, right? But itulah, that is something that you can expect lah. Every day he will ask the same thing. The thing about people with dementia, if they are occupied with other things, is a good thing. Like Anjan say, have a routine for him and then activity that is interesting and helpful lah. So, but I suppose kita kena terima saja lah that he's going to ask the same question again and again.
Kena reda.
Kena reda. Perubahan tu susah untuk dirinya sebab memory recent semua dia dah tak ingat. Dia ingat yang benda lama. Anggaplah macam music lah, lagu.
InsyaAllah.
Yeah, but
akan cuba.
Kalau tidak frustrating juga kan.
Ya, betul. Frustrating. Itulah Saya akan cubalah atasinya. Terima kasih.
Terima kasih. Okay, thank you, Dr. Radiah. We have any more questions on the floor? Something that you would like to ask?
There's a question from Rin. What's the reason of the short-term memory loss? In the chat. That's all, Dr. Radiah.
I think it's very difficult because what happened is, especially Alzheimer's dementia, it affected the part of the brain that is to do with memory, the temporal lobe, you know. So new things is difficult for them to register. But all things dia boleh ingat because it's so entrenched in the brain. Macam dulu, perkara dulu, dia punya kawan dulu daripada primary school semua dia boleh ingat. Ataupun cerita Piramli dulu dia boleh ingat because it's already in entrenched. But for new memories, they cannot do it because it's that part of the brain that's affected by the temporal lobe to do with memory. So that's why they cannot remember new things. But the old things remain. Yeah. But not all dementia affect memory lah. But Alzheimer's especially affect the memory. I think macam Lewy body it will be different, you know. Sorry.
There's one question here. How do we communicate with someone with frontotemporal dementia who has lost the ability to speak and has cognitive impairment? Sorry.
Well, communication is not always verbal, you know, not just words. You communicate through other ways, body language, a smile, a hug, you know, your eye contact. Unless, you know, the person vision affected because they got cataracts or whatever, that's a different story lah. By the way, it's important to check that the person dementia, the hearing is okay, the eyesight is okay. Because that can be, you know, there's something to go into as well. But verbal, if words are difficult, then communicate using body language.
Right.
Yeah, I
Thank
think
you.
so. Sometimes you don't have to say much, just reassure. Siapkan makanan yang dia suka. Oh, sedap dia makanan. Activity, fun activity, sing together, you know, pray together, read Quran together, whatever that makes the person. The important thing is togetherness, you know. Kadang-kadang people dementia, they feel very lonely and isolated. Nobody wants to talk to them, no layan, nothing, you know, then they're just at home doing nothing but if they feel that people care and they care, you know, and still value them and love them, then the behavior usually improve. Because if they feel depressed because they feel nobody cares, and if then they will get depression as well, and that will make them even less communicative, or they can become aggressive. Oh, as a caregiver, does repetitive reminding works? I guess, is it really important to remember that particular?
Can I answer this question?
Yes, please, Anjang, please.
Okay, it's actually not so important, you know, for the person with dementia to remember everything, because the first thing, you know, you must understand that the person with dementia, the brain is already deficit. You know, you have at least 100%. What we have maybe 40%, 50%, and every dementia is very unique. You know, you can have that a person who was just diagnosed 2 years ago, but now cannot speak. You know, they cannot comprehend because of the part of the brain that is affected. So my advice is that always the safety of the person with dementia. Secondly, my advice to ensure that this person with dementia, whatever left with them, they will live a life with dignity and respect. means that, you know, we should give them the respect, you know, because they cannot function. Those who can function, depending on the population and everything, all that. So I think this is important. Thank you.
Thank you. All right, we have like maybe 1 or 2 more questions, final questions.
I saw there's a question on drinks to help improve memory loss or slow down. I don't think there's really such a thing as, you know, supplements to slow down memory loss. Not really. Yeah.
Okay.
There's been research lah, you know, kamin powder. What's that? Kunyit. Kamin. But, you know, so if you eat more curry, spices, it will help reduce incidence of dementia. But I think more important than that are things like healthy lifestyle, the exercise, the healthy food, you know, and staying away from bad habits and happy surroundings.
Okay, there's one question here.
Yeah.
For the less privileged, without the support of family members at home or caregivers, how do they go about their daily routine in terms of safety and etc.?
Well, if it's unsafe for them to be at home alone, then unfortunately they cannot be at home alone, you know. So that, but then to know whether it's safe or not safe, is good to have an assessment from the team that cares for people with dementia and their families lah. So an occupational therapist can help to assess whether it's safe for this person to be living alone, you know. I can say that many people are able to live alone, but and cope, but then they don't have dementia and they're very actively going about their daily routine, going to work, come back. But if you have someone with dementia living alone, that's not very safe. So need assessment. Singapore government, we have a lot of agencies who can come in and do this. Alzheimer's disease, Clark Hill, and other government agencies. From the hospital, we have teams from the hospital who can assess safety. That's why, I mean, apart from nursing homes, hopefully in future we have better things for people with dementia. Maybe not nursing home, but you know, like a group home where there's a communal living, and then there's a person in charge who can assist people with dementia who don't have caregivers. And then I saw a question: can one recover from dementia? Well, dementia is actually degenerative condition, you know. So once you get it, unfortunately, there's no cure for it, you see. So you can become worse, but you can become worse very fast or very slowly, you know. So the main thing is, whatever it is, we want quality of life, but really there's no cure for dementia.
Can I add something?
Unless the dementia is due to, it's not really dementia, it's due to B12 deficiency. They don't have enough B12. That one is not like Alzheimer's, all that. No? You give vitamin B12 injections and the memory improves. That's why when a person is first that so-called have dementia, then we must find out, is it B12 deficiency? Is it due to low thyroid? People who have low thyroid can also be very forgetful. So if it's low thyroid, then it's not dementia. Then there's a cure for it. If it's dementia, it's difficult. But Anjang, you have something to say. I want to hear. Your perspective is so refreshing and good.
Yes. Sorry to say. You know, for person, if let's say you suspect that someone has dementia, you have to bring to the expert, means to the neurologist. You must get, you know, we have to do a lot of tests. There are testing, you know. I normally I fail my test, Then after that test, you have to go for brain scan, MRI, and everything. That will determine the dementia that you have or whatever. But dementia is incurable, terminal, progressive, and fatal. But okay, don't worry about these 4 words. I don't know, Dr. Radiah, but I'm sharing to everyone. For me, how I can survive these 14 years. I was in and out of hospital for so many times. I think more than 30, 40 times because of the dementia. I even have to, I'm a Muslim. I'm a very, I don't call myself as a pious Muslim, but I do everything. I do extra and everything. But I still have suicidal thoughts. When I have suicidal thoughts and they rush me to the hospital, stay in psychiatrist or whatever. So for people with dementia, they have to really, like me, what I did. I will write down all my trigger points or whatever during my good days. When good days, I can think very clearly and everything. And sorry to say, I took a lot of supplement. Actually, a lot of dementia medicine I've forgo because of the very bad side effect, and I've discussed it with my neurologist. So now I took a lot of what do you call that? Virgin coconut oil. I took a lot of turmeric, pure turmeric, which have high level of curcumin, plus a black pepper, and I do it myself. Then I took a lot of omega-3. I took a lot of black oil. I've took it for so many years, and you can see, now how's my condition. Last time was very, very bad. The fluctuation was very, very down. I punched people. I got whacked in the mosque. My aggression was very bad. But now, Alhamdulillah. And to me, to all Muslim, I mean, here who are hearing this, I think they have to do some kind of self-improvement techniques or strategies. Like for me, let me share. I did a lot of meditation, tafakur, in the morning after subuh. Then after before night, my affirmation, what do you call that? Yeah, my affirmation, saying gratitude. Then I wake up about 4, doing my tahajjud and qiyam everything. So the thing is that about dementia, the psychotic attacks is always will go to your emotion. So you will feel very depressed, feel very isolated, this and that. So you have to change that the whatever that coming into your mind, that charge to your heart. You have to do something different, a positive kind of vibes and everything. This one really helps me a bit, a lot. I can say a lot. So I'm not saying that this is foolproof because there's no scientific research or whatever, but I still follow it for so many years. So people are very, sometimes they're surprised. Even my neurologists are very surprised. They say, why, how I can maintain as a state. So there's a lot of hard work, very, very hard work. It's not just a matter of, I have to teach my caregivers, my wife, my children, everything. So I think it is now that we have to really outreach to the many Malay person who has dementia suffering, because there is technique and there is a place, for Muslim we have Club Hill, there's a dementia center and everything on. So we have the mechanism to help. That's all. Thank you very much.
Thank you so much.